Today, the spotlight is on Tork, an Essity brand, which has the innovative products called Tork Clean Hands Training and Tork Interactive Clean Hospital Training. Those are in the Innovation Award program at ISSA Show North America, and it'll be on display, so be sure to see it there. Today with me is Tom Bergen. He is the Healthcare Marketing Director for Essity Professional Hygiene, and he's here to talk about these training programs. Tom, thank you for joining us. And why don't you tell us about your product and what impact it has for those who use it?
This year at ISSA, Tork is introducing two new training tools that we have available, our Tork Interactive Clean Hospitals Training and our Tork Clean Hands Trainings. These are simulation-based training tools that help reinforce and set the highest standards in professional and hand hygiene for healthcare workers and healthcare professionals. Both the hands and surface cleaning are just so critical in the infection preventions in hospitals. And at the bottom line, they help save lives. The Tork Interactive Clean Hospitals Training is a desktop training tool that allows to make that training more engaging and more efficient for the EVS cleaning teams. This training or this module is based on the Association for the Healthcare Environment's practice guidance for healthcare environmental cleaning, which is the market standard for hospital cleaning. For the Clean Hospitals trainings, it is available in both virtual reality versions and also a very new desktop version. In that case, we use a digital environment where you can take the role of a doctor or a nurse and get into an immersive experience of caring for people and also at the same time practicing your hand hygiene. This training is based on the World Health Organization's 5 moments of hand hygiene, and it's based on very highly realistic care scenarios in a very safe environment. The whole goal here is to just get a better awareness of those 5 moments and how they meet with their care routines with the goal of boosting hand hygiene compliance, which hand hygiene is the number 1 way to help prevent healthcare acquired infections. Well, one of the key innovations for these two products is help to reinforce the learning. I think we've all had death by PowerPoint in the past. Well, what this allows us to do is learning by doing, but learning by doing in a very safe environment and engaging way. For a very good example in other industries is there's a reason why when pilots learn how to fly, they start with the book training, they go to the simulations, and then they actually go flying. So this is the same methodology. We're trying to help the hospitals reinforce their training programs to get better clients or better continuity throughout their entire staff. For the Tork Clean Hands training, a couple of things that help reinforce these techniques is we want them to help, reinforce, the cleaning is in a very structured manner. AHE teaches that you clean from a clockwise or counterclockwise manner, something very structured when you enter the room. You clean from high to low, you clean from clean to dirty. And throughout the training event, while they're going through a room cleaning, either standard room cleaning or discharge cleaning, the training gives them prompts and recommendations and tips on what they should be doing while they're trying to hit all those high touch surfaces to make sure that they have a clean and safe room for the patient. In addition to that, the Tork Clean Hospitals training is accompanied by a complete train-the-trainer program that includes either PowerPoint-based versions or other things that allow them to train their staffs in a better manner. It's also available in 25 languages so that we can make sure that we're covering the entire staff. The EVS teams tend to be very diverse organizations, so having those languages available will certainly help. As for the Clean Hands training, well, it brings hand hygiene compliance to life in virtual reality, which is really the most immersive way to do training. But we also found that we needed to make it more accessible. So this year we introduced a desktop version as well. And we introduced that in May of 2001, corresponding to the World Health Organization's World Hand Hygiene Day. Through this hand hygiene training, you get to take the role of a doctor or nurse and, like we mentioned earlier, walk through some care scenarios, such as changing a wound dressing or changing an underpad. And just like the Clean Hospitals training, it gives you that feedback and that prompts about when you should be doing hand hygiene, but also at the end, it gives you a full assessment of how well you did. Another thing that's very important to remember is the impact of COVID. Healthcare was affected very differently than many other market segments when it comes to COVID, because let's be honest, healthcare has always maintained that highest standard in cleaning and also hand hygiene. but it has reinforced the importance of that hygiene for everyone else. In a recent Tork study, 7 out of 10 people do have higher expectations when they're walking into a healthcare environment. So any little bit that we can help with these cleaning teams or with these care staff to make sure that we're providing the best hygiene moments is the whole reason being behind this. If you'd like to get more information and you're at ISSA, please come visit our booth. We'll be at booth 3029. We'd love to have you and show you these two tools, plus also our other products and solutions that we have available. It's also available on our website, torkusa.com, on our clean care pages and our resources pages.